On behalf of our board and staff, our heartfelt thanks for joining us this evening as we lift up the voices of our physician advocates on the front lines. We have a very exciting and brief program for you this evening. And to get us started, I want to introduce actor, director, producer, and activist, Olivia Wilde.
Hello, thank you, Jody, and thank you everyone for joining us. I'm Olivia Wilde. I am thrilled to be your MC for tonight's Advocates on the Frontlines fundraiser. Right now, we are all doing as much as we can to keep ourselves, our loved ones, and our communities safe. So thank you so much for being here with us as much as we can all be together. Your support for Physicians for Reproductive Health keeps doctor advocates mobilized as abortion opponents across the country rush to exploit the COVID-19 crisis. I'm an actor, a director, a mother, and an activist, and I, like you, believe that access to comprehensive reproductive health care is a basic human right. That's why when my OBGYN and Physicians for Reproductive Health board member, Caitlin Fiss, asked me to get involved with this event, I was thrilled to say yes. It means a lot to me. Opponents of abortion are, of course, taking advantage of the pandemic to limit access and deprive millions of people of this timely health care. In states around the country, their efforts are creating confusion, fear, and increased risks for both patients and providers. Tonight, you will hear from physician advocates from across the country that abortion care is essential health care and it cannot be delayed. The decisions patients and doctors need to make about reproductive health care cannot stop during a pandemic. Physicians' network of over 400 trained physician advocates nationwide are working around the clock to protect and provide reproductive health care. They're reporting from the front lines about the consequences of abortion bans. They're sharing the facts about COVID-19's impact on access to birth control, abortion care, and birth care. And they're calling on our lawmakers to follow the recommendations of public health experts. We all need to hear from these trusted medical and public health experts, and more than ever before, our advocates really do need our help. Thank you for joining this call to action. Tonight, you'll hear from some of our physician advocates on the front lines, as well as the inspiring voices of the Resistance Revival Chorus, woo, who express their activism through song. And I hope you will let your own voice be heard by making contributions to physicians. A group of committed donors have put together a fund that will match all contributions received tonight up to $100,000. Throughout the program, we'll display a number to text or a link to visit, to donate, and to let your voice be heard. Every dollar raised will go towards lifting up our advocates' voices. Please, please be as generous as you can. And remember, thanks to our generous donors, every dollar we raise up to 100 grand will be doubled. Together we must do this for our heroic doctors. Thank you so much.
Hi there, my name is Dr. Kristen Brandy. I'm the board chair for Physicians for Reproductive Health and an abortion provider in New Jersey. The COVID-19 pandemic has been an incredibly challenging time to provide reproductive health care. I'm coming to you actually from day 6 of my own quarantine. Despite having all the PPE that I needed to provide care, I still tested positive for COVID-19. I'm incredibly fortunate that I have very mild symptoms, but there's so many more vulnerable people out there where this disease has taken their jobs, their sense of normalcy, and even their lives. In this time of crisis, it's important that we remember that abortion is essential health care.
As a family medicine physician, I have been working at the front lines of the COVID pandemic at a safety net hospital and primary care clinic setting. At my clinic, in light of COVID, we have completely revamped our medication abortion protocol, shifting to evidence-based practices that minimize the need for patient contact, including eliminating unnecessary ultrasounds, blood draws, and in-person follow-up visits. Meanwhile, my practice site in Texas, where I haven't been able to fly during this time, has been battling for our patients to have the basic right to obtain an abortion. Legislators in Texas, who have had no medical training to determine what is medically essential or not, have decided that their political will is more important than science and evidence.
I worry most about the people who weren't able to travel from Texas to another state, who couldn't afford to fly or stay in a hotel, or couldn't find those services because they were shut down from the pandemic.
Abortion care is time-sensitive care, and delays in abortion care can lead to profound effects on someone's well-being, particularly in our most vulnerable communities.
Abortion care is absolutely essential, and to restrict it and stigmatize it in the time of a pandemic when we all feel disheveled and anxiety is absolutely astonishing and disappointing.
I now have several like-minded and highly accomplished physician advocates that I can reach out to. We have been sharing career advice, data, best practices, journal articles, and we've also been there for each other as a support system. This is what we need now more than ever, especially during these uncertain times when politicians are exploiting the pandemic to roll back reproductive access.
Abortion care is essential health care because it can be life-saving for people and it cannot be delayed. Nobody should be forced to carry a pregnancy against their will for any amount of time, nor should they be forced to spend already strained budgets to travel hundreds of miles away, potentially risking their exposure to COVID in order to obtain basic medical care. Maintaining access to abortion care during this pandemic and lifting medically unnecessary restrictions is not only crucial for reproductive autonomy, but is a public health no-brainer that can help to contribute to the effort to flatten the curve and save lives.
I'm hopeful that if we continue to fight this pandemic, that we will not leave abortion care behind. And as we rebuild our communities afterward, that we'll do better to protect reproductive health care.
Well, I went down to the rich man's house and I took back what he stole from me. Took it back my dignity. Took back my humanity. Well, I went down to the rich man's house and I took back what he stole from me. Took back my dignity. Under my feet, under my feet, under my feet, under my feet. Ain't gonna let the system walk all over me. But I went down to the jailhouse and I took back what they stole from me. Took back my dignity. Took back my humanity. Well, I went down to the jailhouse and I took back what he stole from me. Took back my dignity. Took back my humanity. Now he's under my feet, under my feet, under my feet, under my feet. Ain't gonna let the system walk all over me. Well, I went down to the White House and I took back what he stole from me. Took back my dignity. Took back my humanity. Well, I went down to the White House and I my feet, under my feet, under my feet. Ain't gonna let the system walk all over me. Hey, now he's under my feet, under my feet, under my feet, under my feet. Ain't gonna let the system walk all over me.
Hi, I'm Dr. Ghazal Moyetti. I'm an OBGYN and I'm an abortion provider here in Texas.
So my name's Josh St. Louis. I'm a family doctor. I live and work in Massachusetts. And in addition to my primary care work, I provide abortions in Massachusetts and New Hampshire.
My name is Dr. Mira Shah, and I'm a family medicine physician and a proud abortion provider. My experience with providing abortion care during the COVID pandemic has been really tough. Many of our patients are those who are on the front lines of this pandemic, working in the ICU, working as emergency responders. I had a patient who was sitting in her ambulance while getting her telehealth visit for the abortion, and then she drove to our health center in her ambulance, parked, ran in, picked up the medications, and got back in her ambulance and finished her shift.
I have experienced a lot of crazy stuff during this pandemic. And I think one thing I've been really grateful for is living and working in a progressive state that has allowed the primary care and the reproductive health infrastructures to very rapidly transition to one that allows telehealth.
Yeah, it's such a stark contrast, I think, to what I'm seeing here in Texas, where I live, work, and raise my family. Where Texas is a state that has had years and years of oppressive abortion legislation passed. We know that legislation doesn't improve abortion care, but really works to restrict abortion access. And this pandemic is really highlighting and magnifying the repercussions of medically unnecessary laws. So where a 24-hour waiting period before was medically unnecessary, now it becomes almost medically dangerous, requiring people to come in for a non-needed visit, something that doesn't improve their care, improve their safety, but still they have to come in at least a day before. Find childcare when all of us are struggling with childcare so much. It has been a struggle for the people I take care of. Many of the people I care for have lost their jobs. I lost my job. I'm here in my home office now. And in my prior office at work, I used to always keep a picture of my LTA class to remind me of really that higher level of I'm here caring for my community and I have this foundation of people that I can rely on.
I have always felt that being a physician implicitly involved being an advocate for those who are underserved or underrepresented in your community. I now practice in the community where I grew up, and most of my patients do not have health insurance or are minimally insured.
It's incredibly unfortunate that the zip code in which you live in really dictates the care that you receive. It wasn't until I did LTA that I became so inspired to leave my nice little bubble in New York and travel to Indiana once a month to provide abortion care.
Physicians in our LTA cohorts are such great resources for just helping us to sort of stay on top of it, of like, what is the lay of the land? What are other places doing? And how can I let that sort of inform my own expertise right now?
It feels like a mountain that you could never climb sometimes with the advocacy work that's needed, but having these like weekly or daily connections to your other colleagues who are also advocating or also working reminds you that we're just this expert on this tiny chunk of all of it. And it's important for us to be well trained and well poised to talk about the things that we're experts on and to really display publicly that we also know how to engage with our partners that are experts in all the other stuff too.
Our approach to a crisis is thoughtful, and inclusive, we should be lifting up our voices, and we should be advocating, and we should be talking to reporters and writing op-eds and doing things like that. And I think that Physicians for Reproductive Health is so thoughtful about just making us feel comfortable doing those things and be comfortable in our own expertise. I'm finding during this pandemic that I'm incredibly thankful for that.
Physicians has done an amazing job of being supportive of us when we are in a place of being supportive of everyone around us.
So Physicians was a clear, like obvious choice of something that really fit in line with my goal of why I became an OBGYN, why I became an abortion provider. And it was really the next logical step in doing what I dreamed of doing, which was not just being a physician, but really working to create change, lasting change in the places that I work in and serve.
Hello, my name is Dr. Katie McHugh. I am a mom, an OBGYN, a board member of Physicians for Reproductive Health, and a graduate of its Leadership Training Academy. I am also a proud provider of abortion care in my home state of Indiana. I know firsthand the strains our advocates are under during this pandemic. Last month, the governor of Indiana signed an executive order calling for hospitals and clinics to cancel or postpone all non-essential procedures. As you've heard my colleagues say before me, abortion care is essential and cannot be delayed. I cannot stop providing this time-sensitive care to my patients during a pandemic. Physicians for Reproductive Health has provided me and my colleagues around the country with the support and resources we need to be effective advocates. They provide help when I'm preparing for a media interview. They provide help when I'm preparing drafting testimony or writing a letter to the editor. Most importantly, they provide me with a community. These fellow advocates help me feel less isolated and alone when I do this work that requires all I have to give. Please make a gift to physicians right now. Reply to the text just sent to you or visit the link provided on your screen. Remember what Olivia shared earlier this evening. All donations tonight will be matched. Your impact will automatically be doubled. Your generosity will make a direct impact. A gift of $2,500 helps staff prep advocates for media opportunities. A gift of $1,000 supports security training for our advocates. A gift of $500 underwrites training materials for our new advocates. A gift at any level helps physicians provide a home for those of us on the front lines. Your support means everything to frontline advocates like me. It ensures that we have the support we need to protect the health and well-being of our families, our friends, and our communities during this crisis and beyond. Thank you.
Friends, please be as generous as you can right now. And while you do so, let's hear another inspiring song from the Resistance Revival Chorus. I look forward to reporting back in just a few minutes on what we've raised together. Thank you so much.
This is 23rd Street, transfer to the M23, the Light Bus service.
Well, I woke up this morning with my mind stay on freedom. Oh yes, I woke up this morning with my mind stay on freedom. I woke up this morning with my mind it was stay on freedom. Hallelujah, 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 hallelujah. Hold on now. Stay on freedom. Oh no, there ain't no harm with your mind. Stay on freedom. I said there ain't no harm with your mind. You know it is. Stay on freedom. Hallelujah. 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 Walk now. Walk. Walk. You better walk. 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 With your mind on freedom. Walk. 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 You better walk. Walk. With your mind on freedom. Oh. Better walk. Walk. I wanna walk. Walk. Well, sing and shout it with my mind. Yeah. Stay on freedom. Sing and shout it with my mind. Yeah. Stay on freedom. Sing and shout it with my mind. Stay on freedom. Hallelujah. 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 Hallelujah.
Wow, wow. I mean, that is inspiring stuff. I donated during that song because how can you not? That was so special. Thank you to the Resistance Revival Chorus. Thank you to all of you and our generous matching fund donors. We have raised a total of $198,371. Woo! That is very exciting. I know we can keep it going. If you haven't given yet, our text to give number will remain open until June 1st, or you can always donate via the website. Tell your friends, share with them everything that you've learned today, continue asking questions, and spread the word, and remind people that it's timely. We have to give now. One last thing before you go, please save the date of Monday, September 14th, when we will hold another virtual event, this time with John Oliver, much more exciting, to honor our 2020 Voices of Courage Award winners, two of our country's bravest abortion providers, along with Teen Vogue, the winner of this year's Voices of Change Award. We look forward to seeing you then. Stay safe. Stay well. Thank you again for supporting our advocates on the front line. I'm so grateful and honored to be amongst you all. Thank you.